Hi, my name is Christy McConnell. I'm in Bio 251. For my project, I'm doing a health disorder that occurs due to non-disjunction, and I chose trisomy 21, also known as Down syndrome. What is Down syndrome? Down syndrome is a genetic condition that occurs when an individual has an extra chromosome 21. This is because either the sperm or the egg that fused during fertilization had 24 chromosomes instead of 23. This can result in abnormal physiology and cognitive impairment resulting from the expression of that extra genetic material due to having 3 copies of chromosome 21 as opposed to the normal 2 copies. What is non-disjunction? Non-disjunction is the failure of chromosomes to segregate or separate during and after meiosis. During the anaphase, it is possible that the homologous chromosomes do not separate. This means that an extra chromosome will go into one cell and another will have one fewer. This is called non-disjunction, and it can lead to chromosomal abnormalities such as Down syndrome. Over here is an image of what should happen during meiosis. And then this is what happens in non-disjunction. And down here, this is where trisomy 21 would happen. And over here, this is where monosomy 21 would happen. And monosomy 21 is theoretically equally as probable as trisomy 21. However, it is typical in utero. It's another chromosomal anomaly characterized by the absence of all or a portion of chromosomal 21, which typically, like I said, results in a miscarriage. Fertilization determines the outcome. Only if the gamete containing the extra chromosome is part of the zygote will a baby with Down syndrome be born. This happens in 1 in 700 babies, according to the CDC. Down here, I have an image of a maternal serum screening. A maternal serum screening is something that is used to detect trisomy 21 in the first trimester. Typically, it is done 10 to 14 weeks of gestation, and it allows the detection of trisomy 21. How does that happen? A mother's blood carries DNA from the uterus, which detects the genetic material. In addition, if it's positive, an amniocentesis can be performed to confirm the diagnosis. If it's negative, usually no further testing is needed. And over here, I have an image of the Down syndrome karyotype, which also detects trisomy 21. In Down syndrome, there's differences in physical features. There's a flattened nose, especially the bridge of the nose, almond-shaped eyes, a short neck, small ears with an overfolded helix, and the tongue tends to stick out of the mouth. For your palms, a single line across the palm of the hand, which is the palmar crease. Smaller pinky fingers that allow sometimes curve toward the thumb. And you have small hands and feet, poor muscle tone, or loose joints. Typically, they're shorter in height as children and adults, and the skin folds at the back of the neck, which is shown right here. Down syndrome also has musculoskeletal effects. This is how it is in the synovial joints. So typically, Down syndrome has enlarged joint capsule, and that leads to increased risk of injuries. So the first image over here is an image of a hip in a Down syndrome child. And you can see that it is dislocated, as shown in the X-ray image. Over here, it's a slip capital femur epiphysis, meaning the head of the femoral growth plate breaks at the hip socket. And over here is a patella dislocation, a lateral patella dislocation, I should say, in a Down syndrome patient. This is the musculoskeletal effects in a cartilaginous joints. Here I have an image of a neck and an image A. This is the ilano-axial joint instability, which is common in people with Down syndrome. And this is compared to a normal ilano-axial joint. Well, over here, I have a picture of a child born with Down syndrome that has scoliosis. And over here, I have a picture of after surgery. See all that metal that straightens out the spine. Down syndrome also affects our organ system functions. And I have listed how it affects the intestines. 5% are prone to blockages or stenosis. They're likely to have celiac disease, umbilical hernias, malformation of a bile duct, rectal prolapse. For cardiac, they're prone to one or more congenital heart defects, atrioventricular septal defect, ventricular septal defect, isolated atrial septal defects, and pulmonary hypertension. And over here, I have hematologic, which is cell count abnormalities. They are predisposed to leukemia. Also polycythemia, which is excess red blood cells. Leukopenia, which is decreased white blood cells. And over here is an image of a Down syndrome baby and mental retardation, low set of ears, abundant neck skin, singular palmar crease, intestinal stenosis, hypotonia, gap between first and second toes, predisposition to leukemia, which I've said, umbilical hernia, protruding tongue, congenital heart defects, and epicanthal folds and flat facial profile. There's also a difference in the cognitive ability. There's impaired development in the first year of life, delayed speech. Typically, on average, the first word was at 18 months. Impaired cognition, ADHD, conduct oppositional disorder, aggressive behavior. 7% are diagnosed with autism. Also, they're also diagnosed with a degenerative disorder, which is like worsening autism-like behavior, cognitive decline, such as dementia, premature structural aging. Over here, I have a bell curve of a distribution of IQ. This was a study taken in 21-year-olds with Down syndrome. And as you can see, the average IQ in a Down syndrome is 40, and the average IQ in 21-year-olds without Down syndrome is 100. And down here is the image of an aging brain in Down syndrome. Down syndrome also affects male and female reproductively. Most males with trisomy 21 are sterile. There has been cases that there's actually 3 known cases that males have successfully reproduced, depending on their level of Down syndrome. Causes of sterility vary, but sterility is not guaranteed. Many females with trisomy 21 have been reported to have had babies, and many of them are actually normal. Females with trisomy 21 can be fertile, or some have been documented to be subfertile due to reduced number of ovarian follicles and increased rate of atresia. Theoretical rate of a Down syndrome patient having a child without Down syndrome is 50%. And this is my reference slide. Thank you so much.